Can my eyes be improved upon? Loosened lids, canthus removed from eyeball? After previous surgery, I ended up with loosened lower eyelids and a space between the canthus and eyeball. My eyes kept getting dry, irritated, and debris got trapped. I underwent a bilateral canthopexy. The concerns seem unchanged. Eyes are still dry, debris gets trapped, and lower lids still loosened, plus canthus removed from eyeball. Compared to my original eyes, the canthus appears to be in a much lower position after the surgeries, plus the lower eyelids seem longer. What can still be done to improve?
Thank you for your question. You stated in your question, which you didn't submit with a photo, however, you described the details of your concerns regarding your lower eyelids. You state that you had lower eyelid cosmetic surgery and you dealt with an issue where the eyelid was away, or the canthus, the corner of the eye, was away from the eyeball, and that you underwent a procedure called a lateral canthopexy. And further along, you also described that the canthopexy did not seem to change or improve the situation. And in addition, you feel like the eyelid is lower and the lower eyelid is longer. So again, in the absence of a photo, certainly there are some limits in what I can describe in terms of my approach, but I can tell you I'm very familiar with the type of situation you're in. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and one of the areas of specialty which I have in my practice is the revision of complications of cosmetic eyelid surgery. In fact, we take care of situations like yours in our practice for patients who come to us from all over the world. So to essentially understand what your issue is, as well as why perhaps the most recent procedure did not work as expected, I'm just going to give you a little bit of understanding of the terminology and the principles that guide how I approach this problem. To begin with, when you had lower eyelid blepharoplasty, seemed likely from your description and from my experience that you had a blepharoplasty or lower eyelid surgery done from the outside the eyelid, and subsequently in the healing process your eyelid pulled away from the eye. Well, we refer to that as ectropion, which means the margin of the eyelid is away from the eyeball. Okay? Now, beyond that, you feel like your lower eyelid is lower. The terminology for that is lower eyelid retraction. And in terms of the description of the eyelid being longer, I suspect what you're seeing is more of the white, or what we refer to as scleral show, and it can certainly make the eyelid appear longer. But I would say that it's more typical that the horizontal width of the eyelid actually becomes shorter. Now, as far as the principles, the guiding principles of how to address this problem, we have to deal with just basic, simple anatomy. Simple, but in the way the lower eyelid is much more complex in the way the lower eyelid support is critical and balanced. There are three elements that are important. One is the connection of the lower eyelid to the bone, called the lateral canthal tendon. It's kind of a suspension part of a suspension bridge. The next part is the front of the eyelid, which is the skin and the orbicularis, or the anterior lamella. Then another part is the posterior lamella, which represents the lower eyelid retractors, the conjunctiva, and the orbital septum. Or the orbital septum is sometimes referred to as the middle lamella. Now, this is a lot of terminology, but the point is that when I do a revision for lower eyelid surgery, these elements have to be assessed. Are they intact or do they need repair? A lot of times people try to do some type of a shortcut procedure or make a best effort at doing what they feel is an issue. So in the lateral canthopexy, basically one element may have been addressed, which was the lateral canthal tendon or the suspension of the eyelid. Typically, in my experience, the problem is there's inadequate support from behind the eyelid. And if you think about it, it's the support and structure of the lower eyelid. It's like pillars. And when surgery is done, and this area is not addressed to maintain support, or if in healing that support is compromised, then it's like the pillars collapse. So my job as a revision surgeon is to restore that anatomy. So we'll place grafts on the inside of the eyelid, and then if there is a skin shortage in the front, then we place grafts or skin graft in the front of the eyelid. A lot of times the doctor who did the cosmetic eyelid surgery may not be as comfortable or familiar with these procedures and will try to do something as a, quote, shortcut, whether it's a lateral canthopexy or lateral canthoplasty. And sometimes it can be beneficial enough. Ultimately, you have to be happy with the final result. But it has been my experience that people will go through anywhere from 1 to 7 or more operations before they find an alternative which is more involved in the short term but will provide long-term benefit. So at this point, I think it's very important for you to understand that there are options, but you have to discuss with your surgeon what would be the next step. I think it's still important to maintain this communication with the original surgeon and see if there are options such as the one I described that they are familiar with. If they're not familiar or comfortable, then you may want to move forward and look for a specialist, someone, a cosmetic and reconstructive oculofacial plastic surgeon. Right? In my practice in Manhattan and Long Island, we focus in these particular areas and we do a lot of this. So this becomes something that we do fairly routinely. And I think it's important that experience, and in addition we use a lot of advanced wound healing technologies such as the use of extracellular matrix and platelet-rich plasma. Basically, the systems are in place so that we're able to get consistent outcomes. I think this is the kind of situation where you don't have that many more options in terms of the limitations of traditional first-level repair. Now discuss this with your doctor, and if your doctor isn't comfortable, look for additional information by doing consultations with a specialist. So I hope that was helpful. I wish you the best of luck, and thank you for your question.